Now let's discuss about the blood supply of the nose. Since we are talking about epistaxis, and epistaxis is the condition in which there is bleeding from the nose. And when we talk about the bleeding from any area, it's important that we should know the blood vessels that are supplying to that part and how they are affected in the condition. So blood supply of the nose. In this section, we will mainly talk about the blood supply of the nasal septum, then blood supply of the lateral wall of the nose, and at the same time we will talk about Little's area, which is the site for epistaxis in about 90% of the cases. So it's the site for epistaxis in most of the cases. Then we will talk about the retrocolumellar vein. So all these three sections, these three terms we will discuss in this section. First, the blood supply of the nose on both septum and lateral wall. So blood supply of the nose here, if you see, we talked about the little area, and the little area is also known as Kieselbach plexus. Here the four major blood vessels in which we have anterior ethmoid artery. This is the anterior ethmoid artery. Then we have a sphenopalatine artery, superior labial artery, and then greater palatine artery. All these arteries come together and form a plexus, and this plexus here is known as the little area or Kieselbach plexus here. So four major arteries: anterior ethmoid, sphenopalatine, greater palatine, and superior labial artery, where they come together and form a plexus. This area is known as the Little's area, and this is the site for the epistaxis in about 90% of the cases. The other artery here, you can see the posterior ethmoid artery is there, but it's not actually taking place in the formation of the plexus, so it's not included here. So the little area is the area where the four major vessels come and form the plexus. So on both the septum and the lateral wall is supplied by external carotid system and internal carotid system. So roughly, the blood supply of the nose, including the nasal septum and the lateral walls of the nose, is divided into two major divisions. One is the external carotid system, the other is the internal carotid system. The nasal septum is supplied by, again, internal carotid system, which is anterior ethmoidal artery and posterior ethmoidal artery. Nasal septum is supplied by the two branches, arteries of internal carotid system. One is anterior ethmoidal artery, other is the posterior ethmoidal artery. The external carotid system that supplies the nasal system, we have sphenopalatine artery, septal branch of greater palatine artery, and septal branch of superior labial artery. So these are all the branches that comes and supply to the septum. One branch is from greater palatine artery, other branch is from the superior labial artery. Both of them come and supply the nasal septum. So again, if we summarize it, the nasal septum is divided into internal carotid system and external carotid system, which supplies the blood to the nasal septum. The internal carotid system has in turn two divisions: anterior ethmoidal artery and posterior ethmoidal artery. The external carotid system has three branches. We have sphenopalatine artery, then the septal branch of greater palatine artery, and septal branch of superior labial artery. So this is the blood supply to the nasal septum. Posterior and anterior ethmoidal artery, they are branches of the ophthalmic artery which is supplying to the eyes. Next, the lateral wall of the nose is supplied again by internal carotid system, which have anterior ethmoidal artery, posterior ethmoidal artery. So same as the nasal septum, the internal carotid system has two branches, anterior ethmoidal, posterior ethmoidal, and they supply to the nasal septum also and to the lateral wall of the nose also. They are the branches of the ophthalmic artery. Then the external carotid system is posterior lateral nasal branches, greater palatine artery, branches of facial artery to nasal vestibule, and nasal branch of anterior superior dental. So external carotid system is different between the septum and the lateral wall other than the greater palatine artery. The rest is different, but the internal carotid system both have the same blood supply, which is from the anterior ethmoidal and posterior ethmoidal artery. These two are the branches of ophthalmic artery. The posterior lateral nasal branches are from the sphenopalatine artery. This is greater palatine is from the maxillary artery, and nasal branch of anterior superior dental is from infraorbital branch of maxillary artery. So different branches from the major blood vessels supply the lateral wall of the nose, which is in the external carotid system. Little's area, as I mentioned already, the four blood vessels that come and combine to form a plexus here, which include anterior ethmoidal artery. Anterior ethmoid artery supply both the lateral wall and the nasal septum, and it participate in the formation of the Little's area. The posterior ethmoid artery, even though it supplies the septum and the lateral wall, but it is not taking part in the formation of the plexus. Sphenopalatine artery is taking part in the formation of plexus. Then we have greater palatine artery and superior labial artery. Little's area in anterior inferior part of the nasal septum. So this is anterior inferior part of the nasal septum. This Little's area is present. Exposed to drying effect, fingernail trauma. This is the usual site for epistaxis. We said that 90% of cases are from the Little's area, and it's in the anterior inferior part of the septum. So it's very easily prone to different conditions like drying effect and finger. When some people have the habit of putting finger in their nostrils or nose, so they keep on pricking and cause damage to the little area and lead to epistaxis. Usual site for epistaxis, the different arteries which bleed easily is anterior ethmoidal, septal branch of superior labial, septal branch of sphenopalatine, and the greater palatine. So these are some arteries that are very prone to bleeding or epistaxis: greater palatine, sphenopalatine, septal branch, and septal branch of superior labial and anterior ethmoidal artery. These form the vascular plexus, these two, greater palatine and inferior ethmoidal, they form the little area or Kieselbach's plexus. Retrocolumellar vein. Retrocolumellar vein runs downwards behind the columella. Columella is the front part of the nose here, and this vein runs behind columella, cross floor of the nose. So it's on the floor of the nose. Join venous plexus. This venous plexus here, this is the Woodruff's plexus. So this Woodruff's plexus, site of venous bleeding in young. So this is the retrocolumellar vein, is the site of bleeding in the young children, and it runs on the floor of the nose and combined with the plexus, which is this Woodruff's plexus here. This Woodruff's plexus, vein plexus, inferior to posterior end of inferior turbinate, site of posterior epistaxis. So retrocolumellar vein runs on the floor, join this plexus, and it is the site of bleeding in the young children, and it's inferior to posterior end of inferior turbinate, site of posterior epistaxis. That was all about this section. Thank you for watching sqadia.com.